Hey everyone, welcome back to Ask Dr. Slater. In this series, you get to ask me, a board-certified orthopedic specialist with 17 years experience in this field, your healthcare questions. So if you found this helpful, make sure to like and subscribe so you can submit your own questions that we'll be answering each week. Let's get to it. What about a Morton's neuroma? So a lot of people don't know this, but a Morton's neuroma is a nerve that's an extension, a branch from the sciatic nerve. So an irritation of the sciatic nerve can cause a problem down into the foot. So if you're having this issue, especially if it's bilateral, especially if it comes and goes, especially if the treatment that you've got to this area at the foot, which is typically some padding and some injections, isn't helping, maybe think working up the chain, up a little higher where the nerve might actually be irritated. The symptoms that you're feeling in the foot might be from an irritation of the nerve higher up, and I have seen this clinically. So for a lot of people out there suffering with a Morton's neuroma, before you think getting the surgery is the solution where they literally remove that nerve, maybe think treating the back. So if you get a fusion, what can be done if it doesn't make you better? So I did a podcast about fusions and about how they're really not a great answer. Most of the time patients don't feel better, and within a few years, their symptoms have returned or they need another surgery. And this person wants to know, if this happens, what can be done? What can be done if the fusion wasn't the right solution and you're actually worse afterwards? Well, the short answer is nothing. Once you're fused, you're fused. That's it. Changing that is a significantly more difficult and complicated surgery, and it probably isn't going to happen. What they will do is they'll fuse levels above and below, saying that they didn't get all the levels. I wouldn't go back for that, but a lot of people do. The longer answer is that you can still likely treat the levels above and below conservatively and get the relief that you're looking for. A lot of times these fusions are done at the L4, L5, L5, S1 levels. And a lot of times those aren't the actual levels that are causing your problems. But they're the most observed on imaging like x-rays and MRIs. And it says to us who are reading and interpreting it that this is the problem. But that's the problem in and of itself. You should be diagnosed and treated based off of your symptoms, not off of an image. And because of this, a lot of people are getting fusions to the area that isn't the actual problem. So short answer is, if you get a fusion and it's worse, can you do anything about it? No. Long answer is there's still treatments to levels above and below, especially if those were the actual problem areas in the first place. Can a back problem cause tingling in both feet? Not only can it, it's most likely. So this person writes, I have tingling on the outside of both feet, sciatica in my right foot. Can your back cause tingling in both feet? Yeah, absolutely it can. And if it's on the outside of your feet on both sides, it's probably an L4 issue. That's about how easy as it is. Your back problem can cause symptoms anywhere down your leg, and it doesn't typically follow a line like most people would think. And it sounds logical that it would, that if you had a problem pushing on a nerve in your back, anywhere that nerve goes would hurt. Unfortunately, that's not the case, and that's why you get a lot of misdiagnoses out there. You can just have pain in your big toe, and it'll get diagnosed as arthritis or gout or something else, and it's actually coming from your back. You can have pain in your shin, and it'll get diagnosed as something different, but it's actually coming from your back. So a back problem, a nerve problem, can cause pain, numbness, tingling, weakness, and a bunch of other symptoms down your legs. If you've been dealing with plantar fasciitis for 2.5 years, you probably have a back problem. That's about as easy as it gets. This person writes, I've been dealing with plantar fasciitis for 2.5 years and no one is getting it. The frustration. Yeah, and I feel you, honestly. Being in pain for that long is frustrating. It starts to limit your life. You start to think there's nothing that you can do. You're always going to be this way, but maybe start to think that you've been getting all the treatments to your feet, right? The cortisone injections, the taping, you've done the rolling, the ice, the stretching, you've done the night splints, you've done all of the stuff that you're supposed to do, and none of it's really working. Well, maybe it's not your feet. And this is what I found. I'm a 17-year orthopedic expert, and now when somebody says, I have pain in my feet, I look at your feet, but then before I do any treatment, I also look at the correlating area of your spine, because often, very often, the underlying problem is actually a spine issue, a nerve issue, and not a foot issue. And if you're out there and you've been getting treatment longer than 4 to 6 weeks, and you're not seeing significant improvements, somewhere around 50%, 20%, 25%, right? Something. If you're not seeing those improvements, then start thinking, maybe the diagnosis was wrong. That's it for this week of Ask Dr. Slater. Make sure to leave your questions in the comments. Make sure to hit like and subscribe so you don't miss this series. Stay tuned next week.